Hello everyone and welcome back. So this is a venous blood gas report with electrolytes. Let's break it down clearly and connect all the concepts so you understand both numbers and the clinical meaning. Venous blood gases. Okay, so first look what are abnormal in this report. First of all, the pH is 7.22, the normal is 7.35 to 7.45, so this is decreased. The partial pressure of CO2 is 27.7, the normal is 35 to 45, so this is decreased. The partial pressure of O2 is normal, sodium is normal, potassium and calcium. Okay, HCO3 is 11.2, so this is also decreased, the normal is 21 to 28. So from this report and the findings that are present here, we will find whether it is metabolic acidosis or alkalosis, and whether it is respiratory compensation or not, and what is the anion gap here. Okay, so coming toward our topic, venous blood cases. Okay, the pH here is 7.22, which is decreased. HCO3 is 11.2, which is decreased bicarbonate, and the partial pressure of CO2 is also decreased, which is 27.7, which shows low CO2. Okay, whenever the pH is less, it shows acidosis, so this is acidic. Okay, so here the base excess from these values we are having is minus 15, so the minus 15 shows strong metabolic acidosis. Okay, so this immediately tells us that the primary problem here is metabolic acidosis. Now coming towards the core concept of this acid base balance, that what is the concept? Core concept. So the pH is maintained by the body, the CO2 is maintained by the lungs, and the HCO3 is maintained by kidneys. Okay, so now what is the key relation? Now if the HCO3 is low, it means that this is the defect due to kidneys, so this is metabolic defect. And if the CO2 is decreased, this is the respiratory, as it is controlled by the lungs, so respiratory. Okay, CO2 is low, this is respiratory and this is metabolic. Okay, now what is happening here, we will discuss it step by step interpretation of this result. Okay, coming towards the step 1, first of all the pH is low, 7.2 to the normal is 7.35, so this shows acidosis, first one. Then the step 2, whether it is metabolic or respiratory. For this we will look at the HCO3. HCO3 is low, which is 11.2, so it is metabolic. Now step 3, is it compensating or not? We will get to know this from partial pressure of CO2, as it is maintained by the lungs, so it is 27.77, which is also low, so it means that the lungs are blowing off CO2, so this is compensating. Okay, so we have learned from the values that pH is low, HCO3 is low, and CO2 is low. Now the pH is maintained by the body, HCO3 is maintained by the kidneys, and partial pressure of CO2 is maintained by the lungs. So if HCO3 is low, partial pressure of CO2 is low, it means that this is metabolic and it is compensating, and the pH is low, it means that this is acidosis. So now we will label this term as a whole as metabolic acidosis with respiratory compensation, as the CO2 is low, so we get to know that the kidneys are trying to get off of the CO2, so it is respiratory compensation. Okay. Now, what are the types of metabolic acidosis? We will discuss this. From these values, we get to know that this is metabolic acidosis. Now, what are the types of metabolic acidosis? So, we will get know these types by anion gap, and anion gap is a formula which is sodium plus chloride minus HCO3. Okay. So this is the addition of subtraction of sodium with the addition of chloride plus HCO3. So here in the report we are having the value of sodium as 130, chloride is 109, and HCO3 is 11. So we get the value 10. The normal anion gap, we should remember this, is the value for normal anion gap is 8 to 12. Here the value is 10, so this is normal anion gap. Now we can label this metabolic acidosis with respiratory compensation as normal anion gap metabolic acidosis with respiratory compensation. Okay. Now what are the causes of this pattern? This is normal anion gap with metabolic acidosis. So it may occur from, the cause may be diarrhea. Diarrhea leads to the normal anion gap in which loss of the bicarbonates occur usually. So diarrhea may be the cause, or renal tubular acidosis, that is RTA, may be the cause. Early kidney failure, it may be the cause, or excess saline infusion. Okay, excess saline infusion, early kidney failure, renal tubular acidosis, and diarrhea. These are the causes for the normal anion gap metabolic acidosis with respiratory compensation. In these cases, the following condition occur. Other important values that may occur is if sodium is less than 130, it may be hyponatremia. If potassium is 4.6, this is slightly highly normal and it can lead to acidosis. Okay, lactate 0.7, which is normal. For this we have to rule out the lactic acidosis. Okay, the glucose is 6.03 milligram per day. So this is not decay. Partial pressure of O2 is 92. So oxygenation is okay. Now what is the clinical meaning of these reports? As we have seen the reports that the pH, HCO3 and CO2 values, and the sodium, potassium and chloride and high bicarbonates value. Now what is the clinical meaning? So it shows that this is not severe sepsis related acidosis. This is not severe sepsis related acidosis. Why? Because the lactate is normal. Whenever lactate is abnormal, this shows that it is due to severe sepsis related acidosis, but the lactate here is normal. Also, the O2 oxygenation is okay.